What year did you graduate from medical school?
I graduated from the University of Utah in 1958.
And how did you hear about the conference?
During the years that I was at the university, we one of the highlights of going during our junior and senior year was coming to Ogden to the Ogden Surgical-Society. In those days, that's the name, Ogden Surgical-Society. And so in my junior year, it was the first year that I attended the meetings here. And that was when they were held at the Orpheum Theater. Now the Orpheum Theater does no longer exist, and it was small, and so they were later moved to Weber State. But at Weber State, the parking was terrible. The thing I remember about those early meetings was that it always rained. It was always a downpour sometime during the meetings, and so we're lucky this year we didn't have we had one, but it was while the meetings were going on.
What is your fondest memory of the conference?
I would have to think that it was the opportunity that I had to be the president of the society. That was a lot of work and a lot of anxiety, but a lot of pleasure in being able to put something together that was successful. And so I would have to say that that was a highlight of my time in the society. During the time that I was president, we expanded the board to include more specialties. Before then, it had just been the executive board that produced the program, with the president dictating what went on. I decided that since there were more specialties now, that we ought to have more representation. And so we expanded the number of positions on not the executive board, but the program committee. And so we went up to maybe 20 people on that committee and included a lot of specialties.
So you started the advisory board.
Okay. Yeah, that's right. I guess that's what we call it. The advisory board was started in my year.
And what impact do you think the conference has had on the community?
Well, in the early years, the society was quite a social event. The Standard Examiner had a whole section of society, and the professional editor for that. And on Sunday, you'd get the society page and see what had happened to the people that were prominent in the community or had the money in the community. And so there was quite a lot of social activity going on and a lot of paper recognition in the paper regarding the society. And so that gave it some credence. But also in those days, everybody was interested in the people who had money. And the original doctors had quite a bit. Well, what else? I think it's drawn people here. I think it's kept the local doctors updated. It's been an opportunity to get your CME credits without having to travel long distances. And if they're pertinent to your practice, it's been very helpful for the community overall.
And can you share some of the early days of the conference on the speakers?
Well, that's the only thing there that I can think of is that most noted probably in the beginning was Alton Oxner, who had founded the Oxner Clinic in New Orleans. And that was sort of a rival clinic to clinics like the Mayo Clinic. And so when he came here, he gave some notoriety to the conference. And I'm sure that he made comments. I've heard that several people have said that this was the best conference in the West, so how do I know? in the real early days, the reason that I knew about it, and I was 15 when it started. But my brother-in-law, Vernal Johnson, was a practicing physician here, and he was instrumental in the early days and knew the doctors, and so I was acquainted with doctors. And that's Val Johnson's father. He lived to be 100, by the way. Well, that's so that's when I began to know and about. Before I ever went to medical school, I knew about the Ogden Surgical-Society. You know, now in the early days, a lot of the activities were held at the country club, not the social activities were. And the president of the society, is my understanding, he had to pay the bill for the president's reception. Thank goodness the president doesn't have to do that today.
What do you miss about the early days of the conference compared to how it is now?
Well, I knew more people. It's kind of a reunion time, and I have classmates that come from Oregon and Idaho, and that I get to see, and that's the only time during the year that I get to see them. But back in the days, early days, I knew a lot more people. Of course, it's different. I don't know many doctors anymore, just the ones I go to. They're all young, I'm old, I'm out of the business 20 years plus. And so it was a social event.
And what impact did the conference have on your practice when you were practicing?
Well, I was a radiologist, and we didn't have a lot of things related to radiology, but it helped me understand disease in general, and then by doing that, I knew it would help me in the interpretation of what I was seeing on the X-ray screens. So it was educational. It's always been educational. And it's always interesting to see what's going on in other aspects of medicine when your main focus is down one line. As you know, I practiced radiology for 30 plus years, most of it in Ogden.
That's great. And do you have any pearls of wisdom for the younger doctors?
Yeah, I do. There are plenty of people out there that want your money. So what I would advise you is to be careful who you spend your money with and avoid the get-rich-quick schemes. There have been many doctors that have been financially ruined. I might be included among them, by people who promise you a lot and you never see your money again. So be careful how you invest your money. The other thing I'd like to say is I think that medicine has become less personal than it used to be. The old bedside manner has kind of gone by the boards. The doctors don't practice in the hospitals as much. And I think that it's very important that your patients know that you're a friend and you're very close to them. And you have their best interest at heart. And so let them know that. Medicine is a business, but it also should be a compassionate service. And so I'd say make that a big part of your practice.
You know, the early days of the meeting, it was, I attended primarily for keeping up contacts with other referring physicians. Things kind of closed down in the medical theater at that time of the year, and so there wasn't much else to do except go to the meetings. But it was one way of keeping up contacts with those who were referring you, and there was some social aspects of the meetings that I think my wife was interested in, and the first few years of meetings of this type have very little to offer. You come out of a residency program having read everything that's available in those days. And as a result, when you have a guest speaker come, he gives the same material that was published several months prior, or a year or two prior. And so you're not really learning anything. After 5 to 7 years, that begins to change because you're not as conscientious about keeping up with the medical knowledge in a written form. But and then the society's changed somewhat over the years. They now have focused more on a specialty each year, or pick something new. And for one, if it's not your specialty, there's not a lot to get except just kind of knowing what's going on in the rest of the medical field. I retired 17 years ago, and in that time I have a little exercise program that I do 3 hours a week, and I listen to medical tapes, and I get much more out of the medical tapes, focusing on family practice medical tapes, more than I ever got from those meetings. But it's it's nice for the community to have an activity such as that. It helps the economy of the community. As I say, it brings a lot of fellowship from getting to see other physicians from outside of your area.
What year did you graduate from medical school?
1952. And then had a 3-year residency program between East Coast and West Coast, went back and forth. And Yale University Hospital in the East and Kaiser Foundation in the West. Came to Ogden to practice in 1956. And I personally knew all of those physicians who founded the Ogden Surgical-Society, but they were, although they had a tendency to sometimes be the prominent surgeon or prominent plastic surgeon, they were all doing family practice in those days. In 1956, there were not very many specialists, and the Ogden Surgical Society was founded by those doctors who were doing basically family practice, although some of us, as I say, had developed a special interest and had a little extra training in surgery or plastic surgery. What else can I tell you?
What do you wish you knew then that you know now, as far as medicine?
Oh, I wish I knew now what I knew then. I've forgotten.
What about any pearls of wisdom for the younger physicians that you'd like to pass on?
I don't think anything as pertains to the Surgical Society.
But pertaining to medicine?
Medicine in general.
Yes.
I think your interests tend to change. I did OBGYN and I would not do that again. And because I don't have the same interest in it. 2, I'm concerned about the medical malpractice situation, which essentially curtailed my practice a little earlier than I would have planned. And but I think, becoming skilled in a certain area is great. There's so much to know out there now compared to what it was when I came out of medical school, that it's impossible to have that family practice now that there was in those days. They don't have the same opportunities, but I don't know that I have any special advice. Pick something you like and stay with it.
That's good. And how did you initially hear about the conference?
Oh, in the early days of when that started, word of mouth, that was a big thing for Ogden. In those very early years, they attempted to get physicians who had developed a reputation from publishing or their position as professorships in various schools, and to get one of that quality was a kind of feather in the cap for Ogden to bring those kind of people here. And they haven't dwelled as much on that, I don't think, as late as they did early on. They're spending their dollars a little differently.
And what is your fondest memory of the conference?
Well, for me, the what's new in my specialty that they had at the beginning of that day was always the most interesting, because it brought in things that you weren't doing and weren't up to date with. So I always enjoyed those and tried to make of the meetings they had, I was more conscientious about attending that portion.
Okay, thank you. They've continued that. That's
Yes,
a huge
they
thing.
still do that.
In the mornings, the mornings are what's new in my specialty, and that's a huge favorite.
Yeah.
So,
Is there anything else you'd like to add? Anything pertaining to the conference? Anything you'd like to add?
I don't think so. I'm surprised that it's survived this many years.
this will be the 68th year.
Yeah.
So, what year did you graduate from medical school?
Well, I graduated in 1947, and then had an internship and a residency for 4 years, and started practice in 51. Isn't that 4 years?
Mm-hmm.
Yeah.
And then how did you hear about the conference?
Which conference?
The Ogden Surgical-Medical Society conference.
Well, I was practicing before they had the conference, and when they went ahead and started making arrangements for these yearly meetings, I was still a student. I was in a residency program or
At the U?
internship, or maybe I hadn't even graduated by then.
Was it at the U?
Yeah.
Okay.
And so I can remember going down to the conferences, and when did they start? What year?
1946.
Yeah, I was going to say, I hadn't graduated from medical school. I was a senior
Okay.
medical student when the conference first started. And I thought they were really good, I thought that, boy, they had all these professors from the big schools here, and they all gave lectures, and I thought, mercy, this is not a bad arrangement that they had here. And so then let's see, I was a senior then, and then I stayed in town to do my internship and residency. So I started practicing in Layton when I finished my internship and residency. I went out to the Tanner Clinic, and I was out there for not very long, and I figured, hey, if I'm going to do obstetrics, I got to get into town. I have to have an office in town. I can't be out here frittering back and forth because it isn't going to work. So I moved into town and set up an office of my own and been doing it ever since.
And what did the what impact did the conference have on your practice?
Well, I think that conference that they have here every year is really beneficial. Really beneficial. It brings all of the professors and all of the leaders of medical things that are going on in the country, and it brings it here to Ogden, and we get quite a few people coming in here now during the Ogden Surgical meetings, and it just keeps you on your toes. You know, you bring people in here, you hear what they're doing, you see how that relates to what you're doing, and these are the professors and known physicians all over the country, and so it keeps you in touch. And then if you want to change, you get changed and pick up information that you want to make up what you don't think you're getting. And I think it's a good deal, good thing. Always has been.
And what impact do you think the conference has had on the community?
On the community? Oh, I think it put Ogden on the map. On the map, especially in the medical circles. Not very often you can get some of these big wheels they've had here, and to come to a little town like Ogden, for crying out loud. They generally wouldn't stop here on a train stop, but they've had renowned physicians come every year, and it's, I think, really put Ogden on the map as a center where people are interested in medicine and its progress and what's going on. And I think it's been a benefit to the city, benefit to the city, because their doctors get a little 3 or 4 days of enlightenment, whatever's going on in the country, and a lot of them have had the professors that come to town, and I think it just keeps everything moving.
Good. What is your fondest memory of the conference?
Well, my best memory was when I was a student. You know, to have all these renowned doctors in town, to come to a little town like this and sit and to listen to what they have to say, I think it made a real impression on me.
And what do you wish you knew then that you know now?
I wish I'd known how many nights I was going to be up in the night, and I probably would have changed my specialty.
Do you have any pearls of wisdom for the younger physicians?
Not really. I think every young physician has his own idea what he wants to do and what he thinks it's going to be, and things have changed a great deal since then.
What year did you graduate from medical school?
April 1946. I was in the 3rd graduating class at the University of Utah's medical school.
And what is your fondest memory of the Ogden Surgical-Medical Society conference?
Well, it introduced me to a man who had been a friend of Dr. Coller's, Dr. E.R. Dumke in Ogden. And he wrote a letter that must have been a favorable letter. I told you I was the very last one in the class to get an internship, and I didn't apply any place but Michigan. And so I'm very indebted to Dr. Dumke, and he was one of the founders of the Ogden Surgical-Medical Society. And he was in practice for some years after I returned even. He wanted me to come back to Ogden, but I loved Michigan, and if things hadn't have happened the way they did, I'd have stayed my whole career at Michigan. But I was never in practice with Dr. Dumke, but he was certainly kind to me, and probably one of the big factors in my even getting an internship.
At the University of Michigan?
Yes.
That's great. So you came back to Ogden when your father died to look after your mother?
Yes,
and
that was 1964, I believe.
And then you became...
No, it wasn't either.
19s.
I can't remember the year that she passed away.
And then
She was 97 when she passed away, so it was a lot of years.
That's wonderful. And do you have any pearls of wisdom for the physicians of the conference?
For the what?
For the physicians at the conference and other health providers, do you have any pearls of wisdom?
I learned some pearls that stayed hidden for a lot of people that I used all through the rest of my years at Michigan. I mean at Ogden. And these were men who had used the things that they were talking about, and I picked up a couple of things that I really think made a difference for patients, and so grateful for that. And I later got to be the what do you call him, the guy who ran the thing for a year. I was elected to be president, and I do not remember the year. And I served on committees throughout the time I was here in Ogden. They were good friends. They were the people I trusted and worked hard for and with. And we had some good years.
That's wonderful. So, what do you wish you knew then that you know now?
I didn't understand.
What do you wish you knew then that you knew that now?
Well, I don't think I'd have changed my mind about having come back to Utah, but that was the biggest thing, the biggest change in my life was leaving academic medicine. And I was there for about 15 years in assistant professor, and was offered associate professor and a big pay raise if I could manage to take care of Mother some other way. But I stayed at, I came home from Michigan.
I want to welcome Dr. Evan Evans. And what year did you graduate from medical school and where?
Northwestern University, December 1950.
Okay. And how did you hear about the conference?
when I started practice in Ogden, Utah. And they were holding the Ogden Surgical-Medical Society meetings. Was the Ogden Surgical-Society, started by Zeke Dumpkin, those people, and Rich. And they met in the old Orpheum Theater downtown, and you sat in the theater listening to people speak. And that's how I started attending the Ogden Surgical Society, and I've been a member ever since.
And what is your fondest memory of the conference?
Probably the first year, because we were new in town, and Dr. George Lowe and his wife Beth, they had parties on Tuesday night before the conference started. And George and Beth said, "Evan, you and Jan, you don't know anybody. You probably haven't any invitations to any of the private parties, so you come and go with Beth and I." And we met everybody. And from then on, things just started to blossom because you got acquainted with everybody. And the thing I like about being a member now, I meet and see people that I probably haven't seen for a year or two, especially like Tom Hammond up in Brigham City. He comes down every year and he switched to bow ties because I wore bow ties. But we have a chance to visit. You don't see him otherwise. So that's why I belong, just for the camaraderie and visiting with people that are coming.
And what impact did the conference have on your practice?
The biggest impact, I'm in a specialty, a narrow field. You attend the conference and it catches you up with what's going in all the other branches of medicine so that you don't fall behind, and if something piques your interest, you'll check it out. So I think that is the biggest contributor to the fact that I have never been in a court of law for malpractice.
What impact do you think the conference has had on the community?
Well, it brought a lot of outside people when I first started in practice, and I think the economic impact with probably 400 doctors coming in from out of town for those 3 days, and it established our reputation to being leaders in medicine.
And tell us your impression of your early years of the conference.
Do what now?
Tell us your impressions of your early years of the conference. What do you miss?
I think it's gotten a little bit too big and separated, but it kept me abreast of what's going on in the rest of medicine, and I feel it prevented malpractice.
What do you wish you knew then that you knew now?
That's, it just kept you out of trouble, so that you knew what you were doing.
And do you have any pearls of wisdom for the younger physicians at the conference?
Yeah? I think the important thing is it teaches you that technology is an aid, not technology making the decision of what you do. And it keeps you practicing and doing a good history and physical so that you know what technology to employ to speed up your diagnosis and treatment.
And do you have any thing you want to say about any interesting cases from your career?
Well, there are several, but one of the most interesting, to make my point about technology, patient and her husband came in and I walked in and I said, "I haven't seen you and your husband for years. What brought you? 32 years after you delivered my last baby, Dr. Evans, and you tied my tube so I didn't need you." Well, what brought you in today? I just spent $6,000 in a medical workup because I just plain don't feel good and have no energy, and I just experience vague pains. And my husband and I got talking, so we made the appointment because you will tell us exactly where we stand. When I did the physical, I called my girl Friday in and I said, see if she's got a KUB, simple KUB film on the exam report. If it is not there, get her scheduled for one now and call my favorite urologist and tell him, Curtis, that she'll be right over to see him as soon as she gets this KUB. They looked at me, why? You've got a huge mass on your kidney. It's about the size of my two fists here. Didn't anybody feel it? No. So I talked to Curtis. He said, have her come to my office as soon as the KUB is made. 2 days later, she was in surgery for carcinoma of the kidney that had been missed. All that technology. Nobody did a good physical exam. They ordered technology. And you could feel it. And I'd have girls, what are you doing? Thump my chest. See how big your heart is. And nobody's ever done that before. But if you hear a murmur, and you don't know what the shape of the heart is, how do you make a diagnosis of what to order? And Grant Holland, if I'd hear a murmur, oh, send him down. And you call me back. You missed, that's a SBE, subbacterial endocarditis. We'll be treating her for the rest of pregnancy with you. This is what you missed, stupid. But I don't know whether there's that kind of camaraderie going on today. They're on salary and practicing technology. And I could tell some tales because we got some interesting things here going. And if you want to hear another story, Erwin Kaiser called me and he said, Eva wants to be treasurer of the Utah Beginning Society. And I said, not unless we do something about these stupid sterilization laws. Because when I started practice, a girl could not have her tubes tied unless she had 6 babies and appeared before the Abortion and Sterilization Committee. Erwin said, congratulations, you're my treasurer. And talked to Bishop Federal of the Catholic Church, and he said, I don't agree with what you boys are doing, but if it'll reduce the number of abortions in this state, I will remain silent. Hugh B. Brown did not remain silent, and I called him on the phone. And what I said to him was not polite, but we were then scheduled to meet with the entire Council of 12 to change the sterilization laws. And George Gasser from Logan saved the day. And George is very prim, proper, been a bishop, state president, regional representative. And they looked at George and said, George, have you ever tied a woman's tubes? No. See, the whole council was swelling up, including Marion Romney. I thought we were going to have to do CPR on him a few minutes later. But he said, you know, I'm only 25 miles from Preston. All the guys in Cache Valley go to Preston and get vasectomies. So I've never had to tie tubes. You see the thing. Then he said, you know, to come to think of it, I don't know of a bishop over 35 in Cache County that hasn't had a vasectomy. I thought we were going to have to do CPR to Marion Romney. I mean, the whole thing. No further discussion, and we were dismissed. But there was no more objection to any woman having her tubes tied at her request at any time, and George Gassler from Logan won the day. And that's fond memory from the practice of medicine. But the medical society meetings, you meet guys you haven't seen for a long time, and you discuss things you've done over the years, and you renew friendships, and they clue you in, well, I learned this little trick, or I learned this little trick. And that's the value of our surgical meetings, and I hope it never changes.
Thank you very much, Dr. Evans. Welcome, Dr. Jack Davis. What year did you graduate from medical school?
I graduated in 1948, and I graduated from Northwestern University Medical School in Chicago. And I'd like to say that was a great experience. And I felt so pleased that I could go to Northwestern because two of the men that were a little older than myself, but close enough that we were good friends, went to medical school there. One was George Lowe, MD, and the other was Tom Feeney, MD. And I knew the high regard that everybody had always had for them as they were growing up, and that they had, of course, accomplished in practice in Ogden. George was a surgeon, and Tom was an obstetrician, gynecology. But Northwestern provided a huge, broad medical experience that, as I look back on it, I'm extremely grateful and thoroughly enjoyed my time there, and some of the people that I met and the way they did things. We're to talk about the Ogden Surgical-Medical Society. I was never in practice in Ogden, but I was born and raised here, knew a lot of the doctors, knew a lot of people, and had reason to come here once or twice a week, always. And my wife was from the area, so I thoroughly enjoyed coming to these meetings. I first found out about them when they were first founded. It was in the newspaper. And it was E.R. Dumke and Alton Oxner from the Oxner Clinic in New Orleans. And I was impressed with how they brought high quality medical expertise to little old Ogden, Utah. And it was so well received, and out of that came of course, originally the Ogden Surgical Society, now Ogden Surgical-Medical Society. Speakers of all different disciplines have been here, and they are of the highest quality. Ogden should be proud of its medical status. I've always been impressed with the high quality of Ogden doctors. I knew some of them, of course, as I grew up here, because there's always been sick people, and there always will be sick people. You're always going to need doctors. Some of the doctors that I recall were Roy Draper, general practice, Conrad Jensen, general practice, but an excellent surgeon, Eugene Smith, pediatrician, and Dr. Morrell, Edward I. Rich, Frank Bartlett, George Pfister. As I recall, George Pfister was actually president of the American Medical Association. So that's a lot of high-powered medical expertise, very capable. And, you know, we have to realize the setting of their practice, particularly infectious disease. Really, no medications. I used to get a septic sore throat once a year. And if you got a rash, it was called scarlet fever. And I remember the first time that Dr. Smith, the pediatrician, came to the house. This would be after I'd had a number of these over the years. And he gave me a little white pill. And he called it sulfa. And in a matter of a few hours, I couldn't believe how well I felt. I thought I had another 10 days of feeling terrible. That was the first time an antibiotic showed up in my life. Infectious disease was big time. The public health office in Ogden had a system of identifying who had what disease. So they would come to your house after the doctor had been there and made the house call. You're too sick to go to the doctor. And he'd make a diagnosis and call into the health department. They'd send their representative out and have a sign that he'd tack on your front door to tell the public which disease you had and which disease it'd be best that you didn't have it. So things have changed a lot. But as I look back on it, they really did a great job. And they were into a lot of good surgical procedures, and I won't attempt to do the critique on that. Well, I think that's my message. I've always enjoyed coming to Ogden Surgical-Medical. I think my first meeting was 1953, so that's getting to be a long time. Didn't make it to all of them, but I made it to a lot of them. And it was well worth the effort. And I had a chance to compare Ogden Surgical-Medical with national meetings. I tried to attend at least 4 week-long national medical meetings every year. So I know a good meeting when I saw one. So congratulations to the Ogden Surgical-Medical Society. I'd also like to put in a plug for Teresa Pasquedra for the great work she does, because those meetings just don't happen. Somebody's got to do the work, and Teresa makes a huge contribution. Thank you.
So what year did you graduate from medical school?
That was June 1945. That was the second 4-year class of the 4-year school. It was a 2-year school prior to that.
Okay. And how did you hear about the conference?
It was announced to us when I was a resident in medicine at the University of Utah that they're having a conference, and one of the speakers from out of town was a friend of Dr. Wintrobe, who was the chief of the Department of Medicine. He was the professor of the Department of Medicine, and he let us go up to these meetings because he said there's some good people there, and that's how I heard about it. He just announced that this Ogden Surgical-Medical also had some people who weren't, at that time it was just Ogden Surgical, and he said there's some people who aren't surgeons alone. They're really good doctors, so I'm excusing you this day or two to go up. So that was fun.
What impact do you think the conference has had on the community?
You know, as you look back from the beginnings in the late 1940s, you realize it has a tremendous impact on the practice of medicine in our area and the surrounding areas like southern Idaho and up as far as Green River and Evanston, that doctors came down here, and it became well known across the country. Even at Harvard, we have one endowment by a doctor who practiced here and left an endowment to have a speaker come from Harvard every year. And you know, as far as the community goes, it's 3 days, an economic impact, helpful to the restaurants and the hotels and the car rentals and things like that. So But I think the most important thing is it's the impact on the practice of medicines by the doctors in this area. That we have one session each morning for 3 mornings. It's called What's New in My Specialty? And it's fun to listen to them. Well, you know, at Vanderbilt we're working on this, Harvard we're working on that, and very interesting things. So I think everybody enjoys that, and you become interested and look it up in, well, nowadays I guess on the internet, but before that, you know, in the libraries and things. So I think it really has an impact because the physicians are recognized. I had one of the visiting physicians, I can't remember his name, and he said, you don't know how important this is. He said, outside of some of the big centers like at Harvard and Johns Hopkins and big areas like that, if I get sick, I'd like it to be in Ogden, Utah, because I know I'll get good care here. So that's an interesting comment. This is one of the professors who was visiting from one of the big universities in the United States.
What impact has the conference had on your practice when you were practicing?
Well, I've attended it almost every year, even after I retired in 1995. I still go every year, and just to see what's happening, not necessarily in my field, but in every field in medicine. What are the new things that are available to people? And I have a large family of 8 children now. 7 actually, we lost a son. But and I want to know what's going on, and you know, with that many children, grandchildren, great-grandchildren, I want to know who the good practitioners are, the ones who practice. So that's kind of an impact.
What do you wish you knew then that you know now?
Well, one thing is I wish I knew how we could have prevented the resistance of bacteria to antibiotics. What we needed to do that many years ago. Part of the problem has been that antibiotics like penicillin and sulfa and tetracycline and all the newer ones have been used for conditions for which they're not indicated, really. Somebody who's got a bad cold, well, take some penicillin. And they take some penicillin or something. And bacteria are real smart. Over the years, they develop things in their genes or chromosomes that make them resistant to this. I can remember penicillin was the most miracle drug most miracle I'd ever seen. I can remember admitting a man once in coma with lobar pneumonia. Couldn't even give us a history, but he obviously had pneumonia. And we got the penicillin out of the safe at that time. It was just coming out. And gave him 20,000 units intravenously every 6 hours. And the next morning he wanted to go home. He felt so good. And cleared right up. And of course, pneumonia then was the #1 killer, not heart disease. It's dropped out of the top 10 now. But I'm trying to think of what else. That would be one thing, is more care in using antibiotics, where not using where there isn't a good indication for them. Well, and to realize that medicine is going to change, and don't put all your eggs in one basket. I can remember some of these conferences where the surgeons would argue. You'd have one from out of the United States, maybe from France or Great Britain, and a couple from the USA, and they would talk about the best kind of gastric surgery to prevent the recurrence of ulcers. One man would say, well, you got to do a vagotomy, and the other one would say, no, you
You have to take out the lower third of the stomach, which makes most of the acid. And the other one would say, well, if you don't take the whole stomach out, it's going to come out in the new part. And jabber, jabber, jabber. And, you know, they would get, you're wrong, pointing their fingers at each other. And people love that, you know, if there's a little controversy, oh boy, this is going to be a good fight. So they would, that's another thing that's interesting, is that really nothing is as permanent as you think it is in medicine. It changes.
What do you miss? What do you miss about the conference, of how it's changed over the years?
That we don't have nearly as many outside physicians coming as teachers as we did at first. We have, and I think this is economics, but we used to have them from, Scotland, Holland, Germany, Japan, the United Kingdom, Germany, I mentioned that. But we used to have at least one physician every year who was a recognized, outstanding man in his field. And because of dwindling of the endowments and the money that's put into it, you can't bring them in like you used to. And so we'll have 4 or 5 or 6 from the University of Utah, and a couple from Ogden who are specialized, say, in diabetes, or specialized in nephrology, or some other specialty or subspecialty. And, you know, you're without honor in your own home, as the Bible says. So that's a factor. And you know, there was a really neat thing about the original Ogden Surgical meetings. The wives were always invited, no matter where they came from. And we would put them up in the Ben Lomond Hotel. Then was really the nicest hotel, very nice. And they had flowers in the room and candy for the wife. And if they knew somebody had a favorite kind of beverage, a bottle of that was usually placed in the room too. And they had a host, everyone had a host, and so you took care of them, make sure if they wanted to go on a trip around the city or up to see Snow Basin or, you know, things like that, you take them up and do that. I guess that still goes on. It's maybe just because I'm older, they don't call on me to do it as much. So those were good things that happened that don't happen now as much.
And can you go over what some of your fondest memories of the conference were?
Oh, one of them, it was a real good one that impressed me and just fortified the thought that it really has an impact on the community and medicine in general. I was a moderator for a meeting, and at that time it was held at the auditorium. It was a new auditorium then at the University, Weber State University on campus. Before that we'd been in a theater downtown and the Ben Lomond Hotel. But for 2 years we held it up there. And of course I sat on the front row and then would get up between speakers or individuals who were on the program, introduce them. And sitting next to me was a reporter from Chicago Times, I think it was. And I started chatting with him, and he said, you know, I'm really interested to be here. I was sent to Salt Lake to report the American Gastroenterological Society annual meeting, which was, you know, a big gathering of all gastroenterologists across the United States. And I did that, and I got a phone call from the boss who said, there's a meeting called the Ogden Surgical Society in Ogden, and we've had several doctors from Chicago go there, and they said it's really a good meeting. You don't have anything scheduled for the rest of the week, So go up there and report on it. And this was, you know, a beautiful May morning, late May, like it usually is. And the hills were green, and the trees were all out, and some in blossom down in the city, and the red rocks on the mountains up there. And I'd chat between introducing, and he says, you know, this has got to be the best kept secret in the world. This is twice as good a meeting as the one I went to in Salt Lake. And it's such a beautiful area. I've never been here. You know, I'm going to come back here. This is gorgeous country, and the meeting is just excellent. So that was the impression of a Chicago reporter at that time. So that was good. A quick note from the Scotchman who spoke, and it was like so many Scottish people, with that thick accent and acute sense of humor. And he started out his talk and said, I'm Dr. Mick something or other. And he said, I want to straighten the people in Ogden out. I've got a picture of the real Ben Lomond. So he flashed this big picture of the Ben Lomond in Scotland. And he said, I want you to know that it's all right for you to name it, but do it with respect for the original. Then he went on with his talk, but he was kind of cute. People were laughing. Got a big thump out of that. And that's sort of on the same theme as the others, yeah. So, well, I mentioned several things in Chicago, and the nephrologist that I hosted was interesting, Dr. Kolf, who was a Dutchman. And Dutchmen are kind of like some of the Germans. They're very opinionated and hard-nosed about things, you know, and they think they're right about everything they do. So I was hosting him, and his daughter came with him. And he was the one who made the first artificial kidney. And it was done at the University of Utah. It was finished at the University of Utah, at least. And very proud of it. Made sure that it was mentioned, and you said sir, and thank you all the time to him. You know, nice guy, but very proud guy. And he was up here, and he had a few things he wanted to do, and that were taken care of by the society. So he was an interesting personality. And, yeah.
Do you have any pearls of wisdom that you would like to pass on to the younger physicians?
Well, things that I've already mentioned about, you know, recognition that things change. You think you've got the answer to some problem, and a few years or months later, it didn't work out. It was just like the discovery of cortisone, and they used it on a group of people with acute rheumatoid arthritis, and was hailed as a cure, because those joints just melded from the great big swollen red fingers and things to normal looking, and he gave talks around the world about that, and he got the Nobel Prize for Medicine that year. And then started finding out you couldn't keep people on cortisone-like medicines because it causes some serious side effects. It had a tendency to increase depression if there was that. It shut off your own adrenal glands, so they didn't work under stress when they should have done. And it also caused the extreme round face and swelling, retention of fluids. And it soon became apparent what was the latest in the miracle drug to cure arthritis, rheumatoid arthritis. Didn't turn out to be so. And it's still used in small doses in varying ways. So just that old saying by one of our poets, "Be not the first by whom the new is tried, nor yet the last to lay the old aside." You've heard that before. Yeah. And that's a good thing to remember, you know, because some of these side effects with other medicines too were quite serious, and found that these NSAIDs, they're called, like ibuprofen is one of them, naproxen is another one, and they were good substitutes for cortisone and for aspirin because they didn't upset the stomach as much. But we started finding out that they weren't too easy on the kidneys either. And so you have to be careful about these things when you start using them. I think that little quote I just gave you, I was trying to think. Lance, who is the author? Did you hear my quote?
Yes,
Well,
I heard it. I don't know who the author is.
Okay. I think it was
Benjamin
Alexander
Franklin.
Pope. English literature fascinates me. I love to read things like that. But at any rate, that's a good thing to pass on to students.
Okay, well, thank you.
Okay?
Is there anything else you'd like to add about the conference? Was there anything else you'd like to add?
Well, those were the little things I mentioned. I don't want to take up your whole afternoon, but no, I've really enjoyed the conference, and I think it has a very good, favorable impact on the Western United States, the way medicine is practiced too.
Well, I grew up in Ogden, and it was always in the papers when I was growing up because it was one of the biggest activities in the Ogden area during the time I was growing up. And I attended a couple of the conferences while I was going to medical school, actually.
What year did you graduate again? I'm sorry, I don't think that got it.
1960.
And what impact has the conference? What impact did the conference have on your practice?
Well, when I came into practice, I was a thoracic cardiovascular surgeon. Some of the speakers that came were some of the very pioneers in heart surgery and in surgery. The conference, the Ogden Surgical Society, was organized by surgeons. And at that time, surgery was a very prominent part of medical practice. And there were many great and marvelous advances at that time. And so we had a number of the premier surgeons, doctors in the country and in the world that came to the conference. I remember both Charles and William Mayo, who established the Mayo Clinic, George Cryle, who established the Cleveland Clinic, and of course Alton Ochsner, who had the Ochsner Clinic in New Orleans, and his son John. Interestingly, John was also my house guest when I was the president, and I was able to find him a pair of 13A ski boots. He'd been skiing in Colorado, so I found him a pair of 13A ski boots in Ogden that he'd been all over the country looking for some ski boots that would fit him. But we also had, I remember we had Rodney Maingott, who was a premier surgeon in England, who wrote at that time one of the best textbooks on surgery. We had Alain Carpentier from France, who was a heart surgeon and developed the Carpentier valve and so forth. Joel Cooper, who formed the Cooper Institute in Texas for physical therapy and for athletic prowess. We pretty much had anybody who was important in the world and the status of medicine and surgery. It was interesting when I became a president and program director, trying to find people to come to the Ogden Surgical Society. I would meet somebody at a meeting that I would be impressed, and I would give them the invitation, and they'd say, "Oh, I'd be glad to. I've heard about this." And so it was a well-recognized meeting across the country and even the world in those early years. So we had a lot of great people that came.
That's great. And what impact do you think the conference has had on the community?
Well, in the early years, it was a big event, big social event as well. There were some social programs. The Standard Examiner would always have a large dedication to the Ogden Surgical Society. At that time, they also had a society section, and that was always very big at that time about the Ogden Surgical Society. Many of the doctors that came, instead of being put up in hotels, would be in the local doctors' homes, where we got to know them a little better and appreciate them, and they got an appreciation of our community as well as in the meeting giving excellent presentations of pertinent information.
What do you miss about the early years of the conference?
Well, it's interesting. I left Ogden in 1985 and came back in 2005, so that's 20 years that I was away from Ogden. And things change, medicine changes, surgery changes, techniques change. I think that one of the things that I miss was that when the Ogden Surgical was on, all the doctors closed their offices, and only emergency procedures were done in the community. And I don't see that now. But for some it's just another meeting that some people can go to if they want to.
What is your fondest memory of the conference?
Gosh. Well, I guess it's with the people that I worked with. I had the opportunity, we had the executive secretary, Phyllis McDonald. She was just a delight. I'd also gone to high school with her, and I skied with her twin brother, and so it was a pleasure working with her, as well as all the other physicians that were on the committee, on the committees and so forth. It was a good time to meet and be with people.
What do you wish you knew then that you know now in medicine?
What do I wish?
What do you wish you knew then that you know now? Like,
I don't know. The medicine and surgery has changed so much since I graduated from medical school. I've had the opportunity to be in teaching positions. I retired as a professor down in Georgia. Worked with the VA, the Air Force, the Army. I was a consultant to the Navy during Desert Storm, and I felt that I kept up pretty well as far as understanding, but the knowledge has increased so exponentially, and no one person can know it all. I remember when I first came to town, there were general practitioners that were doing hip surgery. They were doing everything. They were, quote, general practitioners. They were doing everything in medicine. And now, orthopedic surgery, there's knee surgeons and shoulder surgeons and hip surgeons, and in my specialty, thoracic cardiovascular, there's vascular surgeons and heart surgeons and pulmonary surgeons and pediatric pulmonary surgeons, and there's general surgeons that are specialized in different areas. Laparoscopic surgery is becoming the rule rather than something exponential, and now the robotic surgery is coming in. So new techniques are coming. We're understanding disease at the molecular and genetic level that we never understood before. And I think that the conferences that we have now address some of these issues. And if it's not pertinent specifically into a doctor's immediate practice, it gives a knowledge of what is there. A physician seeing somebody in the office has to have maybe not expertise in other areas, but he has to have some understanding, so that if a patient can't be treated by him, at least he knows what is available and where to refer, etc.
That's excellent. Do you have any pearls of wisdom for the younger physicians?
Well, it's interesting. Again, practice has changed. I was a 24/7 doctor, as were most of the doctors in my era. Now it's 30 or 40-hour week doctors. In my office, I had one gal that did everything. Now offices require about 10 additional people in there to run all the insurance and the regulations, etc. Most doctors now, instead of being professionals, are becoming employees of corporations. IHC is a good corporation for medicine. I'm not taking anything away, it's just a different type of a practice. I think that the important thing, though, is not to lose the thought that you're caring for somebody. The patient is important, not only as a disease, but as a person. We're doing more and more of, instead of the physician taking care of a patient, the patient is put into a committee of multiple people involved in their care. I'm not sure this is good. It's different than what I'm used to. I feel the doctor should still be in charge of taking care of the patient.
Thank you.
Is there anything else you'd like to add about the conference?
Yeah, I'm upset that they changed the name for the OSS, Ogden Surgical Society, to the Ogden Surgical-Medical Society. It's when I was back there as a surgeon, we had a lot of the meeting devoted to medical things. And I think the Ogden Surgical Society established itself as a pertinent organization that we could be proud of. And I think that adding the name medicine dilutes it rather than improves the image. I'm a member of a number of other different organizations that I'm a member of. I'm a fellow of the American College of Chest Physicians as a surgeon. Well, they're emphasizing chest but they involve surgeons. They don't want to change it to American College of Chest Physicians and Surgeons. I think the name Ogden Surgical Society has a particular panache or something to it that didn't need to be changed.